Well, good evening, everyone. My pleasure. My name's Senator Kirk Watson, and it's my pleasure to represent Senate District 14 in the Texas Legislature and to have been a little bit involved in what we're here tonight to talk about, and that is we're having an open forum on the Dell Medical School, which will be located here on the campus of the University of Texas at Austin. It's a really remarkable time. When you stop and think about it, just a little over 2 years ago, we laid out a vision for this community of 10 goals in 10 years. Almost a year ago, we're right at the anniversary, the visionary voters of Travis County said that they wanted to embrace that vision and that they wanted to make sure that we had the opportunity to have a medical school at the University of Texas at Austin, along with a variety of other things. So as we face this 1-year anniversary, it's time for us to make sure that the community is aware of what the plans are for that medical school and the impact that it's going to have on our community. In addition to the $35 million a year of investment made by the voters of Travis County, the University of Texas system and Seton have committed hundreds of millions of dollars to the building of buildings that will be part of the medical school, a modern 21st century teaching hospital, and others that you'll hear about. And the University of Texas system has allocated up to $25 million a year minimum for this medical school, and $40 million a year over an 8-year period for startup costs plus faculty recruitment. So what's in it for Austin, Texas? Well, among other things, improved health care for all of our residents, a better integrated healthcare network, which you'll hear about, called the Community Care Collaborative, a new, modern, 21st century teaching hospital that will be better equipped to meet all of our community's needs and will be there to help us with things where we'll have additional psychiatric and mental health care beds. It will create the pipeline, or the beginning of that pipeline, for our new doctors as we face our growing shortage of physicians in the community. And it will be the place where we will see the next generation of healthcare delivery and medical research for such things as cancer prevention and treatment, drug delivery, neuroscience, epidemiology, medical devices, pediatric care, and because it is located on the University of Texas campus, interdisciplinary medicine. And finally, the economic driver for this region, especially in the area of health and biotechnology sectors. We live in a unique place in Austin and Travis County. Part of that uniqueness arises out of the important partnerships that we can build on, the very successes we've had, and we'll see new successes, the partnerships with the University of Texas at Austin, the Seton Healthcare family, and Central Health, our Travis County Healthcare District. All working together, we are in great anticipation of being able to open the doors to the first class of medical students in 2016 and meeting our goals in that regard. So thank you all very much for your interest, for your willingness to be here tonight as part of this. And now it's my pleasure to introduce to you the moderators of tonight's open discussion, the news anchors at KXAN News 36, Robert Hadlock and Leslie Rohde. Thank you.
Thank you. Thank you, Senator, and thank you all for being here tonight. We have a distinguished panel here ready to answer your questions. Let's begin by our introductions tonight. Dr. Stephen Leslie is a special assistant to the President for Medical Education and former provost here at UT. Dr. Leslie is also a former dean of the School of Pharmacy here at UT Austin. Dr. Sue Cox is the interim senior associate dean of the Dell Medical School. Dr. Cox is also the regional dean for UT Southwestern's residency program and a professor of obstetrics and gynecology. Trish Young-Brown is the president and CEO of Central Health, a position she's held since 2005. She has also served a 4-year term as president of the Integrated Care Collaboration, the ICC. That's a regional collaboration of healthcare providers that serve the uninsured and underinsured in the Central Texas region. She now serves as past president.
Now we'll move to this side of the table, beginning with Greg Hartman here. Seton Healthcare Family's President of Academic Medicine, Research, and External Affairs. He currently oversees Seton's partnership with the Dell Medical School, as well as the University of Texas Southwest Affiliation Agreement, Seton Residency Programs, and the Seton UTSW Clinical Research Institute, Clinical Education Center, and Research. That's a lot. Welcome. Next to him, Terry Broussard-Williams is the Vice President of Government Relations for the American Heart Association Southwest Affiliate. She's a member of the Dell Medical School Community's Involvement Team. She served on the Board of Directors for Leadership Austin, also the Junior League of Austin, and she and her husband Lemuel were recognized earlier this year by Concordia University as 2 emerging leaders here in Central Texas. On the end of the table there, Dr. Pat Clubb has served as Vice President of University Operations here since 2000. Her office oversees campus planning and facilities management, as well as campus safety and security, human resource services, and financial and campus services. Now, the panelists are going to get us started in a moment with some prepared remarks they have for all of us, but we want to let you know what will be happening after they give those remarks. I believe all of you got some index cards, and we ask that you get those questions ready, write them down on the index cards, and then after the presentations are complete, we'll ask you to pass those down toward the aisles, and there'll be some attendants around to pick up those questions. We want this to be very interactive, and we want the panelists to be answering your questions, so please take a moment in the next few moments and write those down. And we know there's a lot of people here, so if not all of the questions are addressed right here tonight, we will try to be using them as the team develops the website and the newsletter information that will be coming out later on in the coming year. So let's begin with Dr. Leslie on the end there.
Thank you. And Robert and Leslie, thank you very much for this evening and for being here to host this with us. And let me begin by echoing some of the comments that the Senator made and say, first of all, thanks to you for being here and just to say how appreciative we are for the Austin and Travis County community in supporting this medical school. It really is the case that the Proposition 1 vote put us in a situation where we could launch this medical school. We could not be where we are today without that. So we are deeply appreciative to Austin and Travis County and this wonderful community that's supporting this. We will follow through on making this an outstanding medical school that all of you expect us to deliver for Austin and Travis County and for the state of Texas, and more broadly than that. This is the first medical school at a major Tier 1 public research university, a major Tier 1 university, public or private, in the last 50 years. These are big deals to start. And we are launching one here. And it is going to be on new models of innovation. This is a real opportunity for us. The medical school will be very much community focused, community engaged. It's going to be an interprofessional model for its educational models. It'll be very interdisciplinary with campus. The medical school will collaborate with the powerful strength of the academic campus that will launch both the educational benefits that we have broadly on campus and connect it with the medical school. But in addition to that, we'll give it the research mission that we need to have for the university and for the medical school in order for us to advance the biosciences and biotechnology as we move forward on fulfilling the other side of the mission of this medical school, and that is the economic development piece of it as well. So we're really thrilled. We're delighted that Seton is our primary partner as a hospital system. They've been fabulous to work with, so supportive financially and programmatically over the years. And they have been with us for years. We almost had a medical school launched in 2008, but then there was a hurricane down on the coast and an economic decline that you probably remember in 2008. But we've been working on this for a long time. Seton has been a fabulous partner with us. Seton recognizes that we need to work together so that we all fulfill the educational and healthcare needs of the community, all aspects of healthcare needs for the community, and we'll be addressing those issues as we go forward here. And let me just finish by saying a couple of things. One, we're so deeply appreciative to the Michael and Susan Dell Foundation for their wonderful support. We're very proud of their $50 million gift after the Proposition 1 was approved, $50 million to support this initiative, and to have the name, the Dell Medical School is a powerful thing for us. So we're very proud of that. And the Kane Foundation also for its support of the medical school, including the support for tonight's program from the Kane Foundation. Last thing is that we have researchers here who are on hand for you to talk to, just give you a flavor of some of the kinds of things that we're going to be working on in the medical school. This will be after this panel. And just a couple of examples of that. You may want to talk with Dr. Chandra Bajaj, who works on HIV and AIDS and on computer modeling to facilitate that research. And Doctors John DiGiovanni and Karen Vasquez, who are working on strategies and mechanisms for cancer prevention. So once again, thank you all for being here. We look forward to your questions.
Dr. Cox.
Thank you. Good evening, Austin. A medical school is coming here. I guess y'all know that, right? That's why you're here, so hook 'em horns for UT Austin. Medical education is not new to Austin. There have been residency programs and students rotating in Austin since about the time I was born, 1955. Can you believe that? Since 1955. So we've had physicians in training here. We're going to build on the lessons that we've learned the last several years with our relationship with UTMB and the students that are here and the residency programs that UT Southwestern Medical Center in Dallas sponsor, and make a world-class place for medical students and residents to train here in Austin. We've cleared several hurdles this year and many milestones have been reached since 2013. First, the funding piece that Senator Watson and Dr. Leslie have just shared, the Board of Regents funding, Central Health and Seton's funding for graduate medical education will continue, and then the generous gift from the Michael and Susan Dell Foundation, and then the valued residents of Travis County and their support through Prop 1. Second, UT Austin obtained preliminary planning authority from the Texas Education Higher Coordinating Board to be able to offer an MD degree or begin planning for that. We also are listed now with the Liaison Committee of Medical Education, which oversees the accreditation of the AOA or allopathic schools of medicine, and we're listed as an applicant school now on their website. So things are moving forward with the accreditation. Third, the development of the curriculum. Can't have medical students here training without a curriculum. The elements and the sequencing of the curriculum are well underway to deliver to the inaugural class of 2016. The curriculum features many early interventions with early experiences clinically for the students, interprofessional education, and training on best practices in healthcare delivery for our students and our community. We're waiting on a dean for final decisions, but various groups have been looking closely at how best to use classroom technology to make the student-faculty interaction more interaction and easier for the students to incorporate the knowledge that we're imparting on them. We want to build and incorporate a robust cultural competency curriculum as well as the social disparities of healthcare in order to provide better for the community that we serve. Additionally, research and scholarly activity will be a requirement for all of our students and will be a unique opportunity for our students to customize their educational experience while taking advantage of the rich opportunities across the UT Austin campus. And finally, a word about our dean search. We've attracted several highly qualified candidates who are excited about the opportunity to lead this Tier 1 university and its medical school in the future. Thank you.
Ms. Brown.
Thank you. It's so wonderful to be with you all here tonight. It's hard to believe that a whole year has passed, but it's a wonderful anniversary to thank you all and the voters of Travis County for supporting this huge vision for our community that will take us not only the next few years, but the next few decades. So from Central Health, thank you very much. Central Health, we're already involved in medical education. We have an affiliate that has 22 community health centers that are an integral part of the teaching program. Medical students and residents and the faculty that accompany them work in our clinics, and we have a very synergistic relationship in terms of providing care to our patients and supporting the teaching mission, the education mission. And we're very happy to continue that and grow that relationship as we continue to expand the medical education continuum here at UT Austin. I would say hook 'em horns, but I didn't go to UT Austin. So. Maybe I could still, I could borrow it, okay. So I think that a couple other points we need to keep in mind, that the creation of the medical school and the effort, the voters' approval of the additional tax revenue funds is allowing us to leverage federal funds, specifically the 1115 Medicaid waiver, to bring hundreds of millions of dollars into our community that we would not have otherwise been able to do. So the taxpayers' belief in this vision is not only supporting medical education, and by virtue of the creation of the medical school, it is supporting the transformation of care in this community. And our attempt at transforming delivery care, I really shouldn't say attempt, our effort at transforming the delivery of care, as Senator Watson referred to, is our Community Care Collaborative, which is a partnership, a more integrated partnership between the Seton Healthcare family and Central Health, as well as all the providers in this community that help us deliver care to the patients every day. This collaborative between the two entities is in fact a 501c3. It's an entity that allows us to put all of our planning efforts, all of our service delivery efforts, and all of our financial management and risk efforts into one entity that creates the synergy for us to deploy new methods of delivering care, to evolve the methods that we have on the ground today. And medical education is going to be part of that. We tend to refer to our community as a learning lab, and I think that's a really good thing. We have the patients with needs, we have a community in need, and we have the opportunity to create great connectivity between education, care delivery, research, applied methods, and begin this journey as the whole country is beginning this journey to transform how we deliver care. So from our standpoint, we believe that the medical school will provide key services to the community, just as we do now, and it will be expanded: primary care, specialty care. We also benefit from the resources of UT Austin and the other schools, the business schools, School of Social Works, School of Pharmacy, School of Nursing. All of these help us create a more robust healthcare system, and having the medical school here will help us integrate all of those disciplines in a more robust way. We are very much looking forward to deepening these relationships. I guess the last 2 years have brought us all together in a way that we never anticipated, maybe a few years ago. But we're very, very happy to be here. We know that what we do collaboratively as entities and what you do to work with us is what's going to make this meaningful for the community, and we're very happy to be part of it.
Thank you.
That's great.
Thank you. I too want to say thank you for the opportunity to speak here tonight. Thanks for all of you for attending too. And also, I know other folks have said it, but thanks to the community for voting for this and giving us the opportunity to do this. You know, one of the amazing things as we think about this partnership and the UT Austin partnership, Seton, Central Health, but there's lots of folks, the federally qualified healthcare centers, community care, People's Clinic, Lone Star Circle of Care, and there's private practices of doctors who are working with us on developing programs. It's just an amazing amount of collaboration and partnership going on. And often in meetings, and I know Dr. Leslie, we've talked about this a few times, we'll have some difficult parts and we'll think, boy, how are we going to get through this? There's a lot of tricky parts to this deal. This is not an easy deal. But the fact that the voters approve this sometimes is a real inspiration to say, we've got to figure this out. This isn't something we can go to our corners and stomp our feet and not do this right. You've got to work through some problems. You've got to let go of some control. You've got to be willing to put resources on the table, you know, even if you don't know what's going to happen. I mean, you've got to sort of let go. And when the voters did that, it sort of inspires us and I think gives us a huge responsibility to do the same thing. The other thing and Dr. Cox has mentioned this too, but academic medicine has actually been in Austin for a long time. Like she said, actually, there's even another statistics I'll give Sue, which is actually the first residency was 1931. We didn't get accredited as a teaching hospital until 1955. And actually, there was even a Seton nursing school in 1915. So there's actually, for almost 100 years, there's been some sort of academic medicine going on there. And obviously now it's really going crazy, and the growth over there is incredible. But through all that time, Brackenridge, which has been the center of that, although Dell Children's is now doing a lot of it, and Seton Medical Center Austin on 38th Street has a lot, and there's other hospitals in town, like St. David's hospitals have some programs going in them as well too. But Brackenridge, which has been the center of all that, was never built to be a teaching hospital through all those years. And that's really one of the complications of what we do over there right now. It's a very crowded facility. And for those of you who've been around and know it's been around for a long time, the building itself has some problems. There's some challenges with, as we put in electronic medical records there, having enough electrical outlets for all the new computer services we have, having computer and service closets that can handle the heat of the servers that have to be there, just simple things like that. Our plumbing system has a hard time handling the level 1 trauma, the intensity of a level 1 trauma center. So there's a lot of reasons we really do need to think about a new facility that can continue to do all the things Brackenridge has done, which is to be the primary safety net hospital and to be the focus of academic medicine and research. But we need a new facility to take advantage of this incredible partnership. So fortunately, Seton went to our parent company, Ascension Health, and after the voter election and other things, agreed to commit to build a new teaching hospital. So we've committed to spend about $295 million. We do have to raise a big chunk of that, but we're going to spend about $295 million to build a hospital that's actually about the size of today's hospital. We're actually looking at programming some things differently, but it's not going to be a substantially larger hospital. And I know some people have asked, given our growth, and you may have heard the statistic that we're getting older than like the rest of the country, our population's aging. And that's true, but we really believe in Central Health, and I think UT is very committed, and Senator Watson mentioned the change in the community clinics. We really do have to change the model of healthcare, starting in Central Texas. Whether they figure it out nationally is a whole other question, but we think we can start change right here, which is to create a healthcare system that's not about getting people in a hospital and taking care of them. It's about keeping people at home, keeping them in the right place to take care of them, and using a hospital when necessary. And so our goals through working with Central Health and the UT and the faculty that come on will be to build a much more robust, vibrant system of community clinics, family care practices, and other physician practices throughout the community, and different ways of delivering care outside of the hospital so that we actually reduce the usage of our emergency room and reduce the inpatient usage in these hospitals. Because the current system of people going to the hospital too often, we just can't afford it as a society, as healthcare systems, as individuals paying those ridiculous healthcare premiums. So there really is not only a new hospital that's going to be built to be a teaching hospital, is going to have space for learning and education and collaboration, all the things you want a great teaching hospital to have, but also a very different model, which is about trying a whole community healthcare model, of which hospital is just a part of it, and hopefully people aren't coming to the hospital as much as they used to. We're keeping them healthy in their homes, and we're keeping our community well. So the hospital is just a part of this general reform and change in thinking about how we deliver healthcare.
Good evening. I am so delighted to be here tonight sitting among this esteemed panel of experts, which I'm not. I've been serving for the past couple of months as a member of the community involvement team. And so I want to talk to you all about how this hospital is going to strengthen the community. As well as for so many of you that are sitting in the audience, I'm really excited to see that you are a member of the club I belong to, and that's Austinites Under 40. And there's so much promise and hope for the future for us and our community. And so, there's so many of us that are part of this conversation that don't wear a white coat or talk about academic medicine on a daily basis. And quite frankly, before I joined the community involvement team, my idea of academic medicine involved a couch, ABC, and Grey's Anatomy. No offense to my NBC friends. But this is a blueprint for medical innovation for years to come and beyond what we even know today. And it's not very often that we get the opportunity and the invitation to be a part of it. And so you might hear me say that I'm excited so many times tonight, but I am excited. And I'm excited for the hope that this will bring and just how much money and the new jobs that will come to our community because of the work that we've all done and the fearlessness that we have given our leaders in this community. And we have said, do the work. We know you're good people, and we know you'll do good work. But getting to some of the things that I've learned on the community involvement team, I recently took a tour of Brackenridge. And as Greg pointed out, there's a lot of room for improvement. but their spirit is not broken, and energy in that building is beyond anything that I expected. I actually left and got on Facebook, like most of us do, and put my picture with Starflight and tweeted about how excited I was. And so this medical school will allow all of us to see that in real time. And we'll again be invited to be a part of that journey as we build the future for Austin. So one thing that they did while I was on the White Coat tour, they showed us a video. And there was a doctor who talked about how this was going to bring so much excitement to Austin. And he actually used 4 words: discover, teach, heal, and prosper. How amazing is that? I cannot wait to see those 4 things come into action. And there are so many examples that they talk about that fits in the equation of those 4 words. One thing that sticks out in my head is the gaps that this medical school will be able to address. I work for the American Heart Association, so I talk about heart disease and stroke all day. But they mention that, and most of you probably know this, if you needed a heart transplant, you can go to a hospital in Austin, a part of the Seton family, and get a heart transplant. But if you needed any other organ transplant, you might have to leave town. And that just really hit home with me. I'm not sure that the majority of our population knows what gaps we have, as well as the opportunities to address the most needy population in our community. And that's something that also excites me. So I hope that those of you who are like me, that don't wear a white coat, and you think of Seattle and all of the Grey's Anatomy staff, that you think about the spirit of the campaign that was talked about so much during the voting, and that was dream, dare, do. And so tonight you get the opportunity to learn some things, actually take some notes, jot some things down, and do. Go to your community and ask your neighbors to join you in spreading the word about this once-in-a-lifetime opportunity we have, this formative medical moment that will not come again.
Well, thank you all very much for coming out to hear about the medical school. I'm going to start by describing the district. I think some of you are familiar with it, but for those of you who are not, for phase 1, the south boundary is 15th Street, the west boundary is Trinity Street, the north is MLK, and the east is I-35. All the initial buildings, including the hospital, will be within that defined district. Now, in May of 2013, the University of Texas Board of Regents approved 4 buildings: the research building, the medical office building, the parking garage, and the Education and Administration Building. It's a total of approximately 515,000 gross square feet, and the budget that we're working with is $334.5 million. Now, this is financed with UT system revenue bonds. We've chosen the architect, and when I say we, I think I need to stop and give credit to our team that's led by OFPC, which is from the UT system. It's the Office of Facility Planning and Construction. They're responsible for all the construction on the campus, and they've worked very hard to get us to where we are. Page Sutherland Page, ZGF, and SLAM are the architects that we've been working with for all of these buildings. Hensel, Phelps, and Beck are the 2 construction firms. Now, in addition to that, and this is the one building that is not within that district that I just described, we are building chilling station number 7 so that we can deliver thermal energy to the medical district. We have chosen Burns, McDonnell, and Flint Co., and that's the team that will be building chilling station 7. We have a lot of constraints with this site and with the buildings, and I'm going to run through just a few of them to give you an idea of what we've been working with over the last number of months. We have to pay attention to the floodplain. We have a 100-year and a 500-year floodplain, and it's taken considerable effort to develop these footprints among this floodplain area. So we can't go down. We also are restricted in how high we can go because we're working with over 40 separate view corridors to the Capitol. And they come in at different angles. And we have looked at the designers have done a great job of designing these buildings in such a way that they accommodate these view corridors that are coming in. We also have Waller Creek, an enormous asset for the medical school, but at this point in time, very important in terms of designing these buildings. We have the street that also constrains us, Trinity. We can't jump over Trinity, so that's defining the westernmost boundary of the buildings. And we have a tight budget and a tight schedule. So with all of that, we've made a lot of progress, and I'm going to give you a brief description of kind of where we are with these buildings. We're finishing up programming at this point. We know what needs to happen in each building and how much space is needed for each function. We know who will be in the buildings and what they need for success. That includes the number of square feet, the services, the equipment, the technology, and many other aspects of the area. The one building that we are still working on in these respects is the MOB. And so it's a little bit behind the other buildings, but not substantially. So for all the buildings, we are in either schematic design or we are about to begin. And so what does that mean? Schematic design is the massing of the buildings. It's not design, but it is putting the building together in terms of what it needs once we know the program. So we know the location of the functions within the building, and we begin to look at adjacencies. What needs to be next to what for the building to actually work? At this point, we still need to be sensitive to the floodplain and to the view corridors, and in schematic, we begin to look at cost. After schematic, we move into design development, and this will show the actual design of the building. It gets into the detail. We will acquire a guaranteed maximum cost, so during the design development phase, we will actually price out these buildings, and we will know, first of all, how much we're over and how much we then have to cut back to get within the budget. In February of 2014, only a few months away, we will go to the Board of Regents with design development, and that is the final approval, and once that approval is granted by the board, then we will begin construction. Now, in construction, we do the construction documents, and then the initial construction will begin in a few months as we begin to straighten out Red River, and I know many of you may have some questions about that. That's a part of the initial effort to get these buildings done. And we will end construction in the early summer of 2016. So we don't have a long time to build these buildings, but we are on schedule and we will stay on schedule. During this period, we have every intention, we've already started working with the neighborhood groups that are nearby and with the community at large in order to minimize what we recognize as inevitable disruptions. We have a tight schedule. We have a lot of building going on in a small confined space, including the hospital. So it's going to take everyone to design a process that will minimize the disruption to the community. Although the tight schedule in some ways helps because we have less time to be disruptive. I'm going to end by making a few comments about the medical district itself. It will be very pedestrian friendly, and it's going to be more like UT and the campus of UT than a large urban health district that some of you may be familiar with. We're going to have a lot of bike lanes. We're going to have a lot of open green spaces. And Waller Creek, that I mentioned earlier as a constraint, is actually going to be a huge asset for us, and it will be important in terms of landscaping, but it will also be, and it is important as we go into the design of the buildings, because all the buildings along Waller Creek are going to take advantage of the fact that we have this wonderful natural resource running through this district, and so we want to be aware of that and use Waller Creek to really beautify and to knit together the medical district. We're very excited. It's a wonderful project, and we are all very anxious to start the buildings.
Thank you very much. Hopefully, a lot of your questions were answered without you even asking the question, because we got a pretty comprehensive overview of it, but we have some folks who have questions, and I'm told that we have some cards that are coming up so we can read the question to the folks here on the panel, and
We'll have to pass, if you have a card with questions on them, pass them to the ends of the aisle. What do we want to do? This way? Where are the volunteers? There'll be some volunteers to pick up. There they are with baskets. Pass the questions. And again, we won't be able to get to all of them, but we will get to a few and sort of try to maybe group some of them in subject matter that we can get to some of your questions tonight.
just bring a couple up. We'll get started here.
Tara wants to. Okay, let's go for it.
Okay, what kind of students will you recruit and when will you post the criteria?
So the first class, as you've heard, will start in 2016. The class size will be 50 medical students to begin. And we will be recruiting broadly across all ranges of economic background, diversity. We will be looking for talented students in the first inaugural class.
That'll start in 2015. And they'll find out they're accepted to medical school in the end of 2015, beginning of 2016.
Great.
All right, how does having a Catholic-run hospital affect the training of medical students and residents, especially with regard to family planning?
I imagine I should probably take that one.
You're ready for that one,
Dr. Cox and Dr. Leslie may want to add to this. I think one of the first things to remember is we have 14 residency programs that have been in operation for quite some time and will continue to operate, obviously. So the programs, and those are all fully accredited programs, and the Catholic Ethical Religious Directives, which are sometimes referred to as the ERDs, actually contemplate and allow for the full teaching of academics and allowing you to get fully accredited, which you have to have, obviously, to have a first-class medical school. So I think we're doing it now. I think as we move forward, we'll continue to observe the same policies and rules to make sure that we're a fully accredited medical school and those services can be provided. There are some services, obviously, for those of you who know some of the issues of Catholic teaching, there are some services that can't be provided in a Catholic facility, and that has been the case for some time now. We have agreements with other hospitals such as St. David's and with community clinics to provide those services. So the full range of services, all of the education are provided throughout the system, regardless of what the services are. There are just some, because of a Catholic healthcare facility, we can't provide in the facility. But again, it's been operational for some time and is being successful, and we're fully accredited and plan to stay that way. Sue, do you want to maybe comment?
I would totally agree. Our OB-GYN residency program received a 5-year, which was the longest cycle you could receive on the last, with 2 accommodations and nothing missing from their curriculum. And we'll continue to provide the education in all areas.
Now the question, will you hire non-tenured track faculty or only tenured track?
Well, the answer to that is we will hire both. Most of the clinical faculty will be non-tenure track. They will be engaged in clinical services. The medical school faculty who are tenure track will be more research focused and in classroom as well, but they'll be both.
And kind of a follow-up to that, will new faculty hires be Seton employees or UT Austin employees?
So both also. So we're working to make sure that we accommodate the needs for the clinical side, which will largely be Seton employed faculty, and the UT Austin side. So there will be both, but it will be one or the other. They will be 1.0 FTEs as we talk about at the university, full-time equivalents, either salaried by Seton or salaried by UT Austin.
Or the volunteer faculty.
Or the volunteer faculty.
Don't forget the volunteer. The community faculty that we will engage to help with the educational programs and our rotations will be from the community and may not be Seton employed or UT Austin employed.
Right.
And I'll just add some context. The current residency programs, all of the faculty and all the residents are Seton employees now, except for a few research positions and a few other positions. So Seton is committed to continue the employment of residents and a lot of the necessary faculty. But as we bring on the medical school, there will be the addition of new faculty who will be tenured faculty and other positions as well too, and an increase in research positions. Some of those may be Seton employees, but a lot of those will become UT Austin employees.
Greg, this is probably for you. What will happen with the old Brackenridge building?
Well, actually, that's probably for Trish, because it's
Okay.
actually
All right.
owned by the.
I'm sorry about that.
I'd be more than happy to answer that question if Trish would let me, but that's
Well, to that point, the old Brackenridge campus, the existing Brackenridge campus we should refer to, is a central health asset. And we will be undergoing a planning process that will, of course, we'll be working with Seton and UT as our partners to understand what we need to make the whole medical district work. But we feel very strongly, and in fact, we just had a conversation with our board about this past Saturday, about how we should utilize the existing space. And we believe that it's one of our key requirements is to continue to understand what the gaps in care are in the community. And so as we program that space, that existing campus in the future, we will continue to identify what the gaps are and what we need, and that will then inform and just help us decide what services get to be placed there. But there will be, there is an expectation that certain of the facilities in our existence now will continue to be used for some period of time. So we're sort of anticipating maybe short to medium-term use and then longer-term use, which we will be doing. The planning for that will be ongoing, but we will be undertaking that early next year in conjunction with our partners.
This question asks each of the panelists to tell us what you feel is the most important medical gap now in Austin, and that needs to be addressed.
Only one?
Only one. Or many.
Well, I'll start with that. I would answer that we are heading into new territory with the Affordable Care Act, and we're positioning as a university to address the future in ways that I think we need to be very data-driven, with health economists analyzing the economics of healthcare, and also attending to the partnerships with Central Health and with Seton, and more broadly the physician community in Austin, to make sure that we have both economic efficiencies and excellence of care and community-based, so that we can analyze this, so that we can use the outcome of that to address policy, so we can help shape policy and best practices as we move into this new era of healthcare, which great uncertainties out there.
I'll add too, I think that's a good answer, because I don't think we have a very good system now in some ways. And so I think one of the things we need is a better system, which is what I think Dr. Leslie's talking about. I'd also say in a lot of the subspecialty areas and some of the things that maybe aren't always the sexiest, like endocrinology and rheumatology and some of those kind of things, which are really difficult practices to build and to run, particularly when if you have a large poor and vulnerable population you have to take care of, which we have responsibility for as well too. It's hard to run those, and those have been difficult kind of practices to provide the level of service. We have some wonderful private practice docs who help us meet that population, but it's very difficult. And I think one of the great things about medical school is it allows you to bring incredible medicine into a community, or to help your medical community even step it up a notch. But it also, because so many of those folks are faculty members or your residents who you're paying to teach or to learn, they're willing to provide care to a population that might be hard to serve because they don't have insurance or whatever. So I think there's a lot of those difficult subspecialties that we have a hard time affording in order to provide care to that gap in population, poor and vulnerable, folks on Medicare, some of those other kind of folks that don't have good insurance.
I'd like to add, one thing that I've learned from my time on the community involvement team is, quite often people go to the current hospital and they're getting treated for their current illnesses, but there will be more space to talk about prevention and help them be more healthy. A good example that I know Seton and the medical team is looking forward to expand is they've built a diabetes program. So people who are needing to be educated in that, they can actually learn how to go to a grocery store and shop based on their current economic conditions and the food in their pantry. And they're actually seeing improvement. So those people aren't coming back to the ER for treatment. And so they'll be able to spread those type of programs.
Got a question here, a couple we can combine, I think. When will you finalize the choice of the dean, and is there a process in place for faculty selection, specifically clinical faculty, and will locally practicing MDs be engaged?
So the process for selecting the dean is ongoing, and we anticipate that if we have success that we hope to have, that we will make an announcement of that toward the first of the year. The dean, when the dean is appointed, the dean will begin the process of selecting department chairs of the core departments. That will branch out in a partnership with Seton. We'll start working on establishing chiefs of services for the medical school and the healthcare. And then the faculty will be built out under that. So it'll come in stages. The first is the dean, then we department chairs, the build out of the clinical services, and during that whole process, then the recruitment of faculty and attaching collaboratively with the campus.
And engaging local doctors and
Yes, absolutely.
And we're already talking to a lot of the local physicians that are interested in teaching and what areas they would like to teach, and so we've got a large database of folks that we'll be able to provide to the dean.
All right, how much emphasis will be placed on regenerative medicine and FDA-approved stem cell clinical trials? Anyone? Next.
Well, I think,
To be determined.
I'm answering a lot of these questions, but I probably should be the person answering. I think all of those things will evolve as the dean comes in and starts looking at anchor research programs that'll become core to where the medical school is going to be headed. But the sophistication of the science that we have on campus and that will connect to this medical school will be able to bring great power to research areas that are chosen.
This one probably for Dr. Pat. How long before the medical school achieves its full capacity of students? And has the school been designed to accommodate potential growth beyond this capacity in the future?
Well, the medical school is being planned now to meet the needs of the entire class, and Sue and others might be able to speak more to the timing of that, but we will be prepared to serve the full class when we open in 2016. Now, if you'll remember that I described these first buildings as phase 1, there's a phase 2 and a phase 3. We have an enormous area to grow. And so as the medical school grows, as research marches on, then we will respond to that with the addition of other buildings. And that will come as success, as we see success with the medical school.
We'll reach the full complement of 200 total students in 2019. And phase 1, again, will accommodate that. Phase 2, if we want to expand the class size, we're designing the phase 1 building that phase 2, it'd be seamless to expand a larger class. Gross anatomy labs, simulation centers, the academies or societies for them learning how to be a physician.
Now, one thing I'd like to say to these last two questions, I think when Senator Watson's 10 in 10 speech, you have to remember the N10 was in 10 years, and so we've accomplished a lot in just a year, but I think we have to remember this first hospital, the medical school, the vision is to really build out a lot of things. I think there's an enormous potential to do all kinds of things, and I think sometimes I remember right after the election, after Prop 1, a few months after that, somebody told me they wanted to know if their kid could get into the class next year. And I said, well, first of all, I'm not going to decide that, but also it's going to be a little while before you get to that point. And I think it's important, and the excitement's important, but I think we're going to start at phase 1, and then things are going to build over time, and we're going to probably learn over time how to make adjustments and what we want to be better at and where we're going to emphasize. So it is going to be a long-term process that's going to build itself out.
And just one more point, as we think about the medical classes and fulfilling the medical classes and back to the Senator's 10 and 10, we need to stay focused on the fact that at that same time, we'll be really attending strongly to the economic development piece of this and building out graduate programs, MD, PhD programs that will attach to this medical school and the academic campus to build out research in biosciences and biotechnology to start down the road of fulfilling the pledge for the economic development piece.
Got another one here. Sexually transmitted injections and substance abuse are plagues in our community. What discernible difference will the medical school make in addressing these at their earliest appearance in individuals in prevention?
I'll take that. Sexually transmitted infections are common, and there's an epidemic in Austin, as many of you are aware. One of the things that the medical school can help provide is the services clinically to detect early and treat, and also to educate. That's one of the things that the students and the residents do, is educate about how to prevent sexually transmitted diseases. So I think we'll see an impact over the course of the next few years.
All right, are there successful models that you're looking at now on new modern healthcare delivery as you make plans? And what are they?
Well,
Trish.
I'll take a stab at that. I think the answer to that is yes. There are different models across the country that we're looking at, but I will take us back to the discussion of the 1115 waiver and the federal program that we're participating in. We have a number of what are referred to as delivery system reform projects where we're attempting new ways of delivering care. Sometimes they're projects that add on to the delivery system that exists now. And part of that is to test those projects to see how successful they are. If they are successful, then we do earn additional federal funds to help us reinvest back into our delivery system. So I think a lot you will see over the next few years, a lot of piloting is what I call it, attempting new ways of delivering care, assessing them, deciding whether they work, if they do, continuing them, tweaking them, expanding them, and if not, putting them aside and going on to the next idea. So I think we're going to see a tremendous amount of innovation occur over the next 5 and 10 years as we, both as a local community as well as a state and a nation, figure out better ways to deliver care.
And I think one more point on this is the beauty of this is that we can start it from the foundations and build and test and establish best practices, and we don't have to tear down old models of existing structures that are out there in other medical schools and health science centers. So this is a place where we'll be able to innovate and work to build best practices.
Now the question, how will you entice students to focus on primary care?
I'll take that.
Entice, I think is the word to emphasize there.
I think one of the things that we're exploring doing with the curriculum is a longitudinal family medicine rotation rather than 4 weeks where you're in a family medicine clinic, which is a requirement by Texas state law that our students get 4 weeks of family medicine. We're going to do it longitudinally, so they'll be able to see people, bring them back, make sure that they've been treated adequately, but start treating families of people rather than just in a snapshot in a day in the office. So I think that will help entice students. No matter what we do, I came from a research-intensive university at UT Southwestern. We have 5 Nobel Prize laureates. Half of our students go into primary care, and the other half go into other fields, but half select primary care as their field.
Couple of questions here. People are excited about this. This person wants to know, when are the student applications going to start being accepted for the 2016 year? And this one, is there any preference given to students coming from UT? Anyone?
Once the LCME, the accrediting agency, says that we can start advertising to accept students, we think will be in June of 2015. We will be able to start taking applications then and interviewing. And then I think we'll leave the preferential to UT. I'm sure there will be, UT has very talented students. They're going to be very competitive. And I will say right now that some of the medical schools in Texas are very worried about the Dell Medical School taking their best and brightest. And I'll leave it at that.
This kind of dovetails with that. How can students be involved with the development of the Dell Medical School?
Another good question. They actually are. We have students that are going to the architectural planning meeting and giving input. We have students on all of our committees. We have several new committees that are going to be formed to help design the clinical curriculum and some of the curriculum threads. And the students from the UT Austin campus have been fantastic about signing up to be on committees, and they're not shy. They give us a lot of feedback.
This person is concerned about the Frank Irwin Center and what will be the future of it.
I figured we'd get that question. The Frank Irwin Center is a 40-year-old building that needs a lot of renovation. And it is, regardless of the medical school, it's not well located at this point, being right there by I-35, remembering it was built 40 years ago. So the Frank Irwin Center will be moved. We don't know about the timing. It will obviously be a number of years, but we will work with the community, work with the city, and begin to look at alternate locations for the Frank Irwin Center. And when that happens, then that will open up that whole entire area for the next phase of the medical school. The timing is not certain, and certainly the location as to where it will go is not certain, but those conversations are beginning.
What considerations were made when deciding to not create a PA physician's assistant program?
Well, I don't know that that decision is a final decision at this point. I think what we're doing right now is pursuing the establishment of a medical school. And then I think as we go forward, we're creating the core elements. You might talk about this too, Sue. We're going to create the core elements of departments, and it's going to grow. And new things are going to happen that we're not going to be able to anticipate right now. It'll just start building out, and it'll feed on itself as it becomes obvious that we need new programs. So I think all of this will evolve. It'll be fun to watch to see how it happens over the next 10 years or so.
And this one's sort of a follow-up, I think, wants to know about the short and long-term plans for fields like OT and PT. How is that incorporated? Same way?
I think the same thing, yeah. It'll open up new opportunities that will emerge as new programs as the timing is right.
And will there be a Department of Health policy at the medical school?
Well, we already have an emerging, very strong health policy group at the LBJ School policy and on campus more broadly. And as I mentioned a little while ago, that we're really focusing on connecting that to health economics to address issues going forward of maximizing economic efficiencies, quality of health care that will help drive policymaking decisions that will come from this medical school.
This person wants to know how many beds will be in the hospital.
It'll be right at about 220 beds, about the same size it is now. We're still playing with the exact numbers, but it'll be roughly about the same size. A few different things in it. We will, for the first time ever, have dedicated med psych beds, medical psychiatric beds, which is something this community has really needed for a long time. That's something very early on in Central Health really insisted we do that too, and it's necessary. And we're also going to increase the number of emergency room bays, not by much, because like I said, we're hoping to dramatically bring down the usage of the emergency room, but we'll probably increase the number of emergency room bays as well. But the overall number will remain about the same as it is right now, around 220.
Okay. Great questions. Thank you so
Great
much.
questions.
We've run out of time for this segment of the evening, but it will continue out in the foyer. We have some refreshments available and some exhibits as well.
Right, I think you heard earlier, the researchers are going to be around to maybe talk about what they're up to these days, and I'm sure some of you will find that fascinating. So thank you so much for coming, and thanks to all of our panelists.